how many experiences do you suggest a therapist have to make them totally familiar with the altered states?
That's a great question. And the short answer is I don't know. I would imagine, probably several to really become familiar with that. And I'd be curious to hear other people's opinions.
In the two opposite extremes, the traditional use of a lot of these substances is with the practitioner, the shaman in that case, if you're talking about hundreds of years ago, traditional use is to take the substance with the patient or with the person that they're intending on helping, which is starkly different than the way that the current clinical trials have been set up, where the investigator may or may not have prior personal experience, but they're certainly not taking the substance at the same exact time. And so I think the mature solution there is going to likely include best practices that are informed from both sides of that equation, from the personal understanding as well as the therapy-centric medical utility.
I think the ideal of a number of experiences is an ideal, and it's going to be challenging to deliver on that ideal. When this intervention achieves licensing, as I think it will, we're going to have an interesting bottleneck in terms of supply to demand. I mean, we already have that. People wanting to get into research studies, but maybe it will be even more sort of intensified when there's more widespread potential access. And so I think mentorship is going to play a major role. That's already part of training programs that I've seen, where although not everyone who's serving as a therapist for psychedelic sessions might have a lot of personal experience, there will be at least one person supervising a team on site who can provide mentorship for those particularly challenging, maybe somewhat anomalous, difficult experiences that can happen, where based on personal experience they can come in and share their experience in a way that helps those who are less experienced to know how to navigate a challenging session.
It's about training, right? It's about training and supervision. And what's going to happen is that as this grows, we're going to find a real gap of therapists. We're going to find lots of doctors that might be comfortable prescribing 25 milligrams of psilocybin, once a week or something. But do we have trained people when we set up the training centers? It's a very personal thing to ask somebody to take something to be, they have to make that choice, and that has to be an informed choice. And I'd hate to lose very good therapists if people say, I'd rather not do it. So I think, to Robin's point, people that are aware, people that are experienced, I think that's crucial. In psychiatry, we have a tradition really that's left to the psychoanalysts. I mean, if you're going to do psychoanalytic training, they expect you to go through psychoanalysis. We don't necessarily have that for a lot of the other therapies. But it certainly is an excellent question, and I think that the training centers that'll pop up, they're going to pop up across the way, and we've been talking about setting some up for ourselves. That will certainly be one of the things that we'd have to consider. I think a therapist that has no other contraindications, health-wise and otherwise, that is interested in doing it, I think as a training center, we should try to make that available, and we should try to help the person through it safely and responsibly. To mandate that for every single person that wants to work in this space, I think that's difficult, given our current sort of, the way we practice and supervise and teach and mentor medicine and psychology, psychiatry.